Good morning, good afternoon, and good night. It is a pleasure for me to welcome you to this event. My name is Laura Claridge, and I'm the Director of Project for Procurement and Buying of Medical Supplies for Mexico on behalf of the UN Office for Services for Projects and the INSABI. We welcome you to the fourth informative session in a open nature for media, Mexican market, and international market, as well as all the stakeholders. In this event, we have in a virtual room of Zoom more than 20 representatives of embassies. We have people from Germany, Brazil, South Korea, United Kingdom, United States, Colombia, Cuba, Chile, Netherlands, Costa Rica, Pakistan, Portugal, Peru, Dominican Republic, Romania, Bogota, Thailand, and Denmark. And also, we have representatives of the main associations and the chamber: ANAFAM, AMELAF, AMIF, AMEPRED, INEFAM, ANADIM, AMIF, DIMELAC, and CANIPHARMA, as well as representatives coming from different international organisms. Welcome you all. Today we are gathering in the room Mario Molina in the joint premises of United Nations in Mexico, and we are transmitting online, live in Spanish and simultaneously in English. We thank you for following this live transmission, this forecast, representatives for civil society and media, the Academy, colleagues on the UN, and the general public interested in this. We are forecasting in this time for people from around the world can be with us. In Mexico, in Central America, South America, Europe, and Asia. The main purpose of this event, as the nature indicates, is to inform, clarify processes, and to keep open the channels of communication. In this fourth event of informative nature, it is one of the following that we're going to have. In the panel, we have Mr. Juan Antonio Ferrer, General Director of INSABI, and Mr. Alejandro Calderon of the same institution. In the same way, we have Giuseppe Mancinelli, Joint Regional Director for Latin America and the Caribbean, and will be commenting a little bit of the procurement of medical supplies and the joint work that has been done with UNOPS. And Mr. Giuseppe Mancinelli will be informing us about the results of the purchasing for the second semester. And finally, we're going to have a Q&A session. As part of the commitment of UNOPS and INSABI with accountability, this live transmission, has, as we said, with a Q&A session for all the doubts to be solved. So we're going to start this session giving the floor to Mr. Juan Antonio Ferrer Aguilar, General Director of INSABI, who will share a message about the joint work that we have done up until now for purchasing medication and medical supplies. Good morning. It is an honor and a pleasure to be in this fourth informative session of open nature with UNOPS. This international organism that came to Mexico under the signature of an agreement with the Mexican government, and they had an agreement on July 31st of 2020 with INSABI. In 2 years, we've seen the strengthening in the institutions that INSABI has had along with UNOPS team, with Fabrizio Feliciani, from our friend Giuseppe Mancinelli, that today is here with us virtually because of COVID, but with a lot of love, we sent a hug to Giuseppe Mancinelli and Laura Carrej, the director of projects in Mexico, and our friend Alejandro Calderon Alipi, who is the person in charge of supply coordination and with whom UNOPS has had this close collaboration. For the ones seeing us and listening to us, the representatives of the different embassies of Mexico around the world, we sent a hug and a warm greeting to the representatives of the chambers of Canifarma in Mexico and the international representatives that today are with us. Warm hug from INSABI's team, the ones that are in the national coordinations of supply and the unit of financing coordination. I would like to tell you that the background of work that we have done up until now, well, UNOPS has acquired for Mexico in 2021 1,050 keys or items. UNOPS acquired 1,050 and 814 acquired by INSABI. For this year 2022, UNOPS has acquired 576 items or keys, and INSABI has acquired 1,412 keys or items of the list. As you know, something that we have done jointly and this coordinated work is that for the acquisition or procurement of these keys, we are making a simultaneous supply by INSABI and UNOPS, and the accompaniment of the Treasury Department in Mexico and Public Function Ministry in Mexico. That is to say that the purchasing of medications and other medical supplies, we have a larger number of companies involved, because if a manufacturer doesn't have 100% of the medical supplies needed, we are resorting to this model that is called simultaneous supply, and we are making the hiring of 2 or 3 companies. So it has been so beneficial for the aspirations we have, and that had been signaled by the President Andrés Manuel López Obrador. What's the design of this coordinated work with UNOPS? Is to reach 100% of the keys or the elements in the list that are required by the country. There's no excuse for Mexico not having 100% of the keys or the items of the list for medical supplies required by the Mexican population. For the people entitled and people without social insurance. And this has been our work in 2 years along with UNOPS. And we have to tell you that the volume of medication that we have bought is around 1,219 million of pieces. And also with UNOPS, we have had a saving estimated for almost 19,000 million pesos. This saving is translated into the fact that we started buying more or higher number of medications than in or compared to the beginning. That is to say that the savings we have are directed to a larger purchase of medical supplies. So it has been beneficial, the relationship with UNOPS. Regarding our status in regards of supply for the institutions participating in this consolidated purchase in the country, that is to say, IMSS, ISTE, SEDENA, SEMAR, the 32 federal entities of the country, I mean the 32 states, and peers. In orders of supply, UNOPS, as from at this moment, has 38,900 orders of supply, and INSABI has 28,013 orders. So we have generated 66,9100 orders from the total number of the keys. Why? Because we are looking for the complete supply at 100%. I will allow myself to say that the orders for supply are not determined by UNOPS or INSABI or the Institute for the Welfare. It is determined by each dependence or organization according to their calendars established through a digital platform called Amatis. In that platform, that was created by instruction of the Health Secretary Jorge Alcocer and his team, in that platform, all dependencies of the health sector that are involved in this consolidated purchase are establishing the real demand and the real calendar of needs. That is to say, we hear in the media that is INSABI, the one not supplying, or UNOPS not supplying. That is not the case. Here, the supply of medications and medical supplies is done according to planning of each organization or institution. Look, the international supply in the consolidated purchase for INSABI has been focused on 23 countries. And in those 23 countries, we had been able to have 117 keys with 100% of supply. In countries such as Germany, Belgium, United Kingdom, Colombia, Switzerland, France, United States, Austria, Italy, Chile, Brazil, Cyprus, Netherlands, Ireland, Puerto Rico, Spain, Sweden, Korea, Cuba, and China, and India, we have had the support of the Foreign Affairs Ministry, the support of the ambassadors of each country. So it has been very helpful, this support coming from all the ambassadors, because the work has been intense during midnight and night sessions. UNOPS, with that openness that had worldwide, called 143 countries. From this, UNOPS has international supply for 7 countries, mainly Brazil, Cyprus, India, in Mexico, Argentina, Chile, and China. That means that between the two institutions, we have called 30 countries to be working in the procurement and in this consolidated purchase for Mexico. And I want to tell you that we are doing well. The work is done per sectors. The work instructed by Jorge Alcocer as Secretary of Health is that even if INSABI today is with the NOPS, we want to tell you that we are working in a coordinated manner each week For example, we have a meeting between the work team of Alejandro Calderon Alipi to check how is doing the supply for institutions. So every week we have a meeting with the IMSS. Every week or every 15 days we have a meeting with the ISTE. Every week or every 15 days we have a meeting with SEDENA, with SEMAR, and so on, for all the institutions to check on the supply of medicines and what it is urgent to address. This has been the position of INSABI and UNOPS. And in this sense, the purchases are moving forward. In Mexico, I would like to tell you that we have the supply of medicines covered, and let's recognize also the problems worldwide about transportation that we experience in the ports that we have for containers, because we also have a decrease in the APIs that are the elements necessary to create the medicines worldwide, but the capacity of UNOPS and the capacity of the Mexican government for addressing the situation was good. And I can tell you today, the ones listening to us, this is setting us in a position of a country that made all the efforts possible to have 100% of medicines and 100% of medical supplies. We are not stopping this work to have this full coverage on behalf of the Mexican population, as it was instructed by the President of Mexico, Andrés Manuel López Obrador. We are not gonna ignore vendors that are complying with the timely supply, because there are some vendors that are providing timely delivery, and some others that are in delay, derived from different factors. But today we are always in an agreement with the norms to look for a way to pay the supply done by these manufacturers, and we will continue this way. Every vendor, every manufacturer requesting the payment from us, it's going to be covered. And we want to tell you that in June, UNOPS has told us that we're going to have more streamlined payment flows in order to have a better relationship with that international supply. And we are so glad for this, because the President, Andrés Manuel López Obrador, has told us that we have the available resources for the procurement of all medicines and medical supplies. And in this regard, we are going to honor the word that all vendors supplying medicines and medical supplies in Mexico is guaranteeing the timely payment. Thank you so much to Mr. Calderon Alipi and his team for working in coordination with UNOPS. I would like to tell you that we remain at your disposal and we are open to your questions. Thank you so much. Thank you. Thank you for your words, Mr. Ferrer. And as Mr. Ferrer commented, the results and the achievements are a lot. And I'm going to give the floor to Giuseppe Mancinelli, Joint Director of UNOPS for Latin America and the Caribbean and representative of UNOPS in Mexico, to tell us about these improvements. So, Giuseppe, the floor is yours. Good morning, everyone. I hope you're listening to me well. Mr. Juan Ferrer, thank you for your nice desires for my recovery. Fortunately, my symptoms are so light, not severe, and I take advantage of this opportunity to remind you that please take care of yourself for fighting against this virus. So please use all the security and health measures to avoid getting this disease. And I want to say hello to my friend Alejandro Calderon, Laura, Thank you, and a special acknowledgement for the ones present in this event. I know that we have a lot of embassies, commercial representations around the world. I'm so glad that you all are here. A special greeting to the pharmaceutical industry in Mexico and around the world. I know that the role of the chamber and associations has been very important for today presenting positive results. A greeting to the media, to all that are listening to us, our colleagues. And this is a day where we can celebrate a lot of things, and obviously the idea is to be able to present the vast majority of the information not related only to the tender process that has concluded. The most important part of the event is this, but I want to remind some important aspects of the process. Some of them were mentioned by Juan, and these are the important improvements, and the objective is to continue improving all the process jointly, because the improvement process is representing at the end of the day an additional benefit for the health of the Mexicans. So this is our commitment also. And I'm gonna make a brief presentation. I hope technology works well. So let's try it now. I hope you can see it well. I'm gonna present a lot of information, so I ask you to be patient. But I think it is important to have the important milestones and the important improvements in this process. First of all, I think it is important to remember that Juan mentioned the commitment that the Mexican government and the president have towards UNOPS and in SAVI regarding impartiality. And let's remind the principles of this process. First of all, about managing the timely supply of medicines and medical supplies. This is the most important objective, because all the efforts done up until now, from the first moment to the last, have to be translated into timely supply of medicines and medical supplies. And I'm going to present a little bit more information, and this is what we are doing. And this is a great reason of joy, because we know that the Mexicans are receiving medicines daily, and this is the most important part. The second objective is promoting transparency and prevent corruption. And this, UNOPS is doing it through the application of a frame, equitative and fair. You can see here the logo. It is the application of principles, universal principles that make that the bid processes can be done correctly. For example, efficiency and efficacy that allow us to have important savings in the participation of the private sector through compliance and open competence, the equality of opportunities for all the sectors participating in the bids, the integrity and transparency, all the due process that is done during the bids. And I'm going to be talking about this more. And the topic related to inclusion, innovation, and technology. All these aspects are fundamental to have the sustainable value of the bids. And lastly, the last objective, that is like a consequence of all the previous work, is about generating savings and increase the yield of the public funds. Juan commented that it is important that, thanks to the possibility to spend less and have the same amount of medicines or more, allows the Mexican state to invest more in resources for the Mexican welfare. So these three objectives are very important, and it is important to have it in mind for knowing the factors that are guiding us in all this process. Okay, in this moment, what we have is basically in the part of the continuous supply, we have been able to keep a flow of continuous supply that is translated in more than 1 million of pieces of medicines and medical supplies delivered. This is important because we can see the impact that we have. Every day, more than 1 million pieces are delivered. Up to yesterday, we have delivered 530 million of pieces, and these are large numbers because are in the benefit of the Mexicans. And these represent 21 therapeutic groups, and in the case of oncological group, 100% of the kits have been delivered. This because obviously we have medicines that are prioritized because they are responding to a need of health that is important. So we have prioritized this, and we have delivered 100% of the keys. And this represents 1,041 keys delivered up until now. So these are important number, and again, the commitment to continue keeping the continuous supply or the simultaneous supply, as Juan told us before. This is a joint effort, what we are doing now. Okay, so let's go to the focal point of today. We are going to know the significant details of this public tender for the second semester of 2022. So, we have received by INSABI a requirement for the second semester of 2022, and I would like to remind you that the last time in the third event, we informed about the previous bid that was covering from June 2021 or July 2021 up to June to 2022. That's why the result we are presenting now is to cover the second semester of 2022 to continue with the supply from June 2022. So from the initial requirement that we have received by INSABI of 634 keys, these are divided in 360 for medicines and 274 for supplies and medical devices. And what UNOPS is doing is a procurement strategy because the purpose is to acquire the highest percentage of medicines and medical supplies and medical devices. So UNOPS has applied a procurement strategy that has been based in three pillars. First, international public bids that have been launched as from the last year for medicines, supplies, and devices. And second, the appropriated bids, that is a more streamlined process that allows us to complement the keys that were not adjudicated from the beginning through the public bid. So we had two appropriated bids. And lastly, the third mechanism was the agreement, long-term agreements. These long-term agreements are mechanisms that UNOPS has with companies and vendors that adjudicated that allows us to expand to a certain point in the supply of goods and medicines in this case. So this is a flexible mechanism that allows us to have a possibility to count on continuous supply. So this is the strategy that UNOPS has implemented. So the result basically of this strategy is that up until now we have 91% of the keys for medicines and medical supplies and medical devices adjudicated. This is the result of the public bid that we have just ended. So this is a very important result. It is a result with a high percentage. Juan also mentioned that the purpose that we have is to have 100% of supply. So we are going to that goal. It is a process of continuous improvement. And afterwards, I'm going to mention some important factors for improvement. And I'm so glad to tell you that today we have 91% of keys adjudicated, and 9% has been informed to INSABI in order to be processed and to acquire what is missing. And for the consolidated purchase can make the 100%. So let's give more details for this bid. So this 91% is representing 576 adjudicated keys compared to the initial requirement of INSABI. In medicines, we are talking about 320 keys and 256 keys for supplies and medical devices, and this represents 128 companies and 7 countries, as Juan mentioned. And here I want to mention or make an acknowledgement for the national market and also the international market, because the truth of the matter is the national market has done very well. We have a strong commitment by the different vendors that have always looked for a dialogue with us, that have always looked to improve their behavior and their yield in the tenders. So Mexico continues being the country with the highest percentage of bids and adjudications. Nonetheless, we have to recognize the effort of the international market. INSABI is looking for, in a very active way, all the relationship with the embassies and with a lot of countries. And within the process we have done with UNOPS, now we have, Juan already mentioned the countries. So I would like to acknowledge the other countries, the other embassies, and the other vendors that have participated and that allowed us to decentralize the market, and these represent better prices and better quality of medicines that we need. So I'm so glad to tell you about this and to give you this data, because this is a positive trend that we are keeping during the years of the bids, and that we are improving the process and strengthening the institutions. We have a great transformation that is constructed over these fundamental aspects. And in terms of pieces, we are talking about 167 million of pieces that obviously, as from the end of the contracts adjudicated, are translated in supply as from June. So we have 167 million pieces that will be delivered in the next months to Mexicans. 10 institutions are part of this consolidated purchase. You can see the list here. And we are talking about 30 states of Mexico. Mexico is, we have the 30 states. Juan mentioned this. We are talking about free access to these medicines. This is the great benefit of this policy, and I have to recognize the effort of Mexico in giving this free access to the Mexicans to these medicines that have international quality, that are responding to international standards. So this is very important to remind, because every Mexican having access to medical supply and medicine has access to a better life quality. And more details. Here we have a breakdown by therapeutical group. I'm not going to give more detail. I think that this slide is clear enough. And here you can see how we are covering the pharmaceutical needs that are more important to allow the supply of medicines needed. Now I would like to highlight, up until now, the result of the international bid. These are the details that I have for now, and we have more details, of course. But in this moment, I would like to move to other aspects, which are the added value of the purchase of UNOPS. We were talking about transparency and effective competence. That is to say that 100% of the companies hired that pass through the process of bid in UNOPS has passed through a due diligence process, a process to promote transparency and effective competence, and this is translated into the different assessment institutions of technical requirements. We have done regulatory compliance assessments, quality, price, efficacy of the products that are offered, and also we have made legal adjustments in the companies. So this implies that those companies that haven't complied with those requirements are not considered eligible, and they can be sanctioned or penalized according to the process of assessment. And here I would like to anticipate something. I would like to anticipate that the result of this year in terms of eligibility has been lower than last year. So this is a reason of proud, because on one side this is telling us that we have a better bid process in regards of making available the details, the information, and the inherent aspects of the bid. But this is also showing that companies have complied with all requirements compared to the last year, where we had a high percentage of non-eligible companies, and this year was so low. So I would like to congratulate the sector working for this. And also we have decreased a lot the criteria or the aspect of technical non-compliance or financial non-compliance. So the process is improving, and this is very important because the main purpose of this is to reach the 100% of supply. And which have been the significant improvements. Let's see the most relevant aspects that we have reached for now. Juan talked about this. We have been able to reduce the days of payments. This had been a topic, a constant topic of concern, the payment, timely payment. The Mexican government had available at all times the financing, and what we have done in the last months is to improve the process of payment, and now we have reduced a lot the time of payment for the companies, as from the delivery of medicines or medical supplies is of 45 days to be done. Even we have made available for the card companies a portal for vendor payment where they can see their payment status. And the most important is that we are paying on time, and we have solved this problem. And now the companies are receiving a timely payment on after delivery. And also the long-term agreements with vendors has allowed us to use this mechanism in the moment we need to supply medicines or to acquire supplies from those companies. So it is a very useful mechanism, and I want to thank for this availability and the continuous dialogue with the representatives of the companies. This is very important to me because the result or the positive result that we can have is a joint effort coming from all parts, and of course the industry is representing a very important part. So I would like to thank the availability, the will, and the pressure exerted by the industry to address some topics or issues. And thanks to this continuous dialogue, we have been able to have a better condition than before. And one of the supplies that the industry gave us is to have a better planning in the production of supplies. In this moment, the bid has ended a time ago, so we are in the phase of the creation of contracts. We have like 80% of the contracts signed, which is allowing the industry to have a period of manufacturing of medicines that can be timely and to be in normal conditions to supply these medicines. And our objective is to continue improving and to give more for having a good result for all parts. And we have also improved the assessment of vendors for their offers, and this is a mechanism within the procurement strategy that allows us to streamline the assessment of the companies that have passed through a pre-qualification process and a better yield of the vendors, because there are many vendors complying and some other have some challenges to comply, but we are working on this. So other important result is the decentralization of the market. I remember in the beginning when we started this process, there was a lot of concern from the Mexican industry for having international companies not complying with certain standards. or medical registration, but thanks to the effort of important measure, the Mexican government has done spectacular work. I mean, specifically coffee praise, and through the bids for the industry, now we have been able to decentralize the Mexican market. The Mexican market has the highest share in the market. Nonetheless, we are opening the market for international companies that are trusted companies, and they know that we have done a lot of modifications and that they have new requirements in order to participate. And also we have other administrative aspects, and this is very important because what we want to do is to supply with the best quality and prices for the Mexican population. And also in terms of transparency and accountability, this is another important aspect that I want to highlight, because we had received a lot of requests coming from different sectors that are interested in knowing the information about the process, about bids. So I'm so glad to inform you that we are listening to the standpoints, to the needs, and along with Insabi through their webpage. And also, UNOPS has made available for all the stakeholders in the page of projects in Mexico. They have all the information needed. We are talking about the keys, the elements of the list that are needed, the details of the consolidated purchase, and all the communications. We have a photo gallery of deliveries with more than 240 photographs of the medicines delivered, and these are physical evidences of the continuous supply that is done. The names of the hired vendors in the adjudication processes, all the calls to international bids, the free online courses about processes of UNOPS for vendors in the global market. That is fundamental requirement, and we have a lot of information there, and I urge you to enter in the page and to have all the information needed. And I ask you to send your requests, and we are gonna analyze what we can do in order to help you and to expand this transparency index with which we are working now. What I commented before, the open competence is going through a process of widespread. We have had a lot of meetings with chambers. We have had more than 20 public events talking about equality, equitative, and access, free access, the embassies that are working, the bid papers that are in English and Spanish. These are the kind of efforts that we are making to give this free and equitative access to information, and the more competitive prices also. And also we were talking about savings, and we are talking about huge savings. And what is most important is that UNOPS is always trying to look for better use of the money, a sustainable value, and this also happens when we can have more competitive prices, even in such a very tough time period that we have during the pandemic. The topic of transportation and containing containers from China. Unfortunately, now the war on Ukraine, of course, will have an impact on the prices. But here, this is a significant example of what we had in prices for hepatitis C in treatment. With the previous price, now we can buy a treatment for 2 patients. And I also want to acknowledge the continuous work that UNOPS is doing in ensuring the quality according to COFEPRIS guidelines, the national guidelines that are from high standards. And this is what we are doing about medicines. We have this as a supplementary mechanism because the regulatory agent is COFEPRIS, but we are trying to complement these strong mechanisms. But we think that our responsibility is also to have an input on this and to make or to have different activities. I'm not going to read this, it is very technical, but I think this is very important to us. And as always, I'm reminding you about the Sustainable Program. This is a program that UNOPS is applying worldwide. That is a voluntary initiative. I want to highlight this. The fact of being voluntary, we can expect that there is non-compliance, but this is not the case. We have a lot of participation in this, and not only voluntary participation, but also corrective plans for some measures that we are doing or we are having with the companies, and this is translated into corrective plans that the companies are following. We have some examples. 17% of the vendors included policies of paternity and maternity, and this is very important for giving more benefits to people. 50% has policies of energy and water saving, and 83% of the vendors are implementing inclusion and diversity plans. So this is very important to remind and to have it in mind as part of the work of UNOPS and for the SDGs of 2030. And we are concluding now with the estimation of milestones and times. So this slide is divided into two parts. The first semester that is about to conclude. So in this first semester, obviously, we have the continuous supply of the 884 keys that are supplied daily, more than 1 million of pieces, but we are closing the contract signature. We are almost in 70-80%, and every day is increasing. And now we are starting in the work of procurement strategies for July to December 2024 up to 2024, and we are working on this, and we are feeding from the resources of INSABI, the health sector, of what the industry is saying to continue improving this procurement strategy. We are working with the vendors and stakeholders, and also with the supply chain. We want to be ready for the second semester and to have everything ready that we can solve every doubt before starting. And as from the second semester, we are going to start with the supply. And we have the closing of the contracts of 2021, and we want to do this in a very ordered process and to have a workshop for vendors, because we want to know what has happened and the improvements they can provide. I mean the feedback. And as from the second semester, we're going to have the fifth informative session covering the years 2023 and 2024 and the covering of all keys. And also INSABI with the continuous supply will supplement what is missing. Okay, I'm ending my presentation here. Thanks for your attention and your presence in this event. I know that it was a lot of information, but I think it is important to have all these details and not only knowing the result of the bid attended, but all the important aspects related to it. And now we are moving to the Q&A session, I think. We thank the words from Giuseppe Mancinelli, and as he commented, we are going to give a space for the questions, and we are going to receive them through this little page that is in the www.lido.com with the code 14 sorry asterisk 1419063. So we are gonna be receiving the questions through www.slid.com with the code asterisk 1419063. So, while we start receiving questions, I remind you, as Giuseppe Mancinelli mentioned, that we have a page of the projects where you can check the information regarding progress and have all news related to this project of UNOPS and INSABI. And the address of this is www.proyectosaludmexico.org. So we're going to the first question, and I'm gonna ask Juan Ferrer if he can answer to it. And what's the benefit of this consolidated purchase of INSABI and UNOPS, the Mexican market? Okay, it is very important to mention two aspects. One, the opening has been this transparency requested by the President, Andrés Manuel López Obrador, that all can have the same opportunity conditions. And we have done this in that way because the processes started by UNOPS have been completely open, and the processes started by INSABI, along with all dependencies on health sector at federal level, the Treasury Department, and the care of the public function, has been a process of market research and bids, public bids, and it has been open as well. In this part, we say that we have counted on the support of another regulatory organism in the sanitary part, that is COFEPRIS, because the only thing that we cannot set aside is the effectiveness of the medicines. And I'm gonna tell you something important that was like request from the President, Andrés Manuel López Obrador. All medicines must be effective for the population. And in that measure, in that extent, COFEPRIS has worked along with Alejandro Calderón-Alipi and his team to make all medicines having all the sanitary registration, and this opportunity has been given to all the companies of Mexico. We have had an opening to support them, to allowing them to participate in all offers, and we have worked on behalf of the Mexican population. And the ones having another version of this, I can tell you, we are not going to stop making sure that the medicine is the best treatment available for the Mexican population. And we have done this in every intervention. And also the health secretary, Jorge Alcocer, is always telling this, that the health sector for the first time is working in a jointly manner. Thank you for your answer, Juan. And let's go to the next question, and I'm gonna ask Mr. Giuseppe Mancinelli if he can answer to it. And the question is, when are we gonna be able to see the winners or of the prizes or the bids adjudicated, and where we can consult this from? Thank you, Laura. Now we are uploading in the page of the projects, that is proyectosalud.org. We are uploading the information of the contracts. As the contracts are being signed, we can upload this information in the page, and the people interested in this information can get access to the. It is not complete for now because, as I'm telling you, we are missing some of the to sign some of the contracts, but as the contracts are being signed, we are uploading the information. There is already a part uploaded, and very soon we're going to have the missing part. Thank you, Giuseppe, for your answer. And we have an additional question for Mr. Mancinelli, because to answer to it, because it's related to the assessment process. I don't know if you can elaborate more on this. It was mentioned during the presentation. How you are checking the due diligence process for vendors? Thank you, Laura. This is very important because, first of all, in UNOPS, we have different instances or agencies for assessment in this process, and obviously we have some function divisions. That is to say that the team assessing has certain distance and cannot make decisions on the recommendations for adjudication. If there is a check-in or and we have certain mechanisms for the ad hoc committee in UNOMS can check that part. For example, if there is legal non-compliance that can lead to non-eligibility, this decision is done through an external committee. And this is very important because in different agencies there is a segregation of functions to keep the integrity of all process. What we normally do is a technical checking, as we were mentioning, of the regulatory part, apart from the prices and technical requirements. And also there's a financial part that is related to the balance of the companies, the guarantees that they are presenting, and the reputation. And there's a substantial checking of the documents. We are checking the documents to see if there's no problem, if they are complying with all the requirements established in the bid papers. There is a legal division also that is doing a checking in agreement with the national agencies to check eligibility aspects. So this is a comprehensive process that is done in the different stages, and that's why it is a long process. But in this time, we can guarantee 100% of the checking for the due process, and this allows us to be satisfied, and we can say that the companies are complying 100% with their requirements. And this is very important because we don't want to have any surprise, and we want to recognize the effort of the companies taking advantage of the time. Thank you, Giuseppe, and let's go for the next question. Alejandro, maybe you can answer to it, and this is related to the consultation on how you are progressing on deliveries with logistic operators, because as we commented, there have been some challenges regarding contracts. I don't know if you can tell us a little bit about this. Yes, of course, Laura. To answer to this question, well, before, as Mr. Ferrer and Mr. Giuseppe did, I would like to thank all participants of all chambers and all vendors that have been supporting in this procedure, because in effect, one of the points that we have found, because one thing is procurement and other is the allocation and receiving of the goods acquired, and we have found a lot of issues and a lot of points of improvement. We have had dialogue with the industry, vendors, and the distribution associations, in which we have had some agreement to streamline the receiving times and the timely delivery of the supplies. In effect, everything can be done better, but we have had some progress, and this is noticed in the data presented by Giuseppe. We have increased exponentially the number of pieces to be distributed, to be allocated, so we have improved substantially the receiving times with the logistic operators. And we continue working because this is very important to address the needs. Thank you, Alejandro, and let's go to the next question. I'm going to ask the support of Juan Ferrer to answer to it. The question is, For the purchase 23-24, will you be considering the same keys requested in the event for the second half of this year? Look, we are already working for the purchase 2023-24, and for this we have the intervention of all institution of health sectors. When I'm saying this, I'm talking about IMSS, ISTE, SEDENA, SEMAR, of course, INSAI. Remember that INSAIs are the national institutes and the high specialty hospitals, apart from the national centers, Senapresi with Dr. Rui Lopez, Esencia, Sensira, and the National Coordination or the National Center of Equity and Gender. In these working tables coordinated by the legal unit and medical unit of INSABI, and also coordinated by the National Coordination of Supply, we are determining which keys or items will be acquired by all health sector institutions, and they are the ones ratifying those keys. We are in this process already. Alejandro Calderon Alipi and his team are know about this, and I may think that in 1 week more we are going to be available for announcing the number of keys that will be acquired by the health sector, because this doesn't depend on INSABI. It depends on the keys required by each and every institution, and we need the ratification process. And then we have another important process. Once we determine the keys to be used, remember that for the Mexican government, the budget is approved for the day September 9th of every year. So we need to wait for our financial link in order to do the due purchasing and the announcements of what Mexico will have in terms of resources for the acquisition of medicine and medical supplies, and this is done by health institution. This is not determined by INSABI. It is determined by the House of Representatives and each institution along with the Treasury Department. Thank you, Juan Ferrer. And we have another question related to this point, that is, if all keys will be tendered for a biannual period, 24 months or calendar year. No, it is going to be for 24 months because the tax exercise, the tax year of our fiscal year of our country is counted per year, and the assigned budget is going from January 1st in the beginning of the year to December 31st of every year. So you may remember that this government will be functioning to October 2024, so we cannot be irresponsible and live without planning and without medicine the last 3 months that this country must have for supply. So we need to think about the 3 missing months that are October, November, and December, and the planning for 2025. Thank you, Juan. Alejandro, if you can help us with this question. The question is that if for the purchase 2023, we are going to have some modification in the national list, including new keys. Well, I'm not the right person to answer to this because the national list is responsibility of the health sector. As all years, we are trying to include some medicines or new treatments, but this is in the hands of the Council of Health. Thanks, Alejandro. I'm gonna ask Giuseppe to answer to this question, where we can see the results of the bids that you have just commented, where we can see the companies and the adjudicated contracts for the events 2022. Yes, Laura. I presented the slide, and there's a page that is www.projectsaludmexico.org. There you can see all the available information, all the keys hired, and the prices, unit prices. As we are signing the contracts, we are uploading this information to be available for the public. And here you can see the consolidated figure, the press releases, the reports, the photo gallery of the different deliveries in the warehouses and final points. And there you can also see the next callings for the next bids. So the page includes all this information. UNOPS has all this communication mechanism. So I ask you to enter in the page and to know about the supplies, to have feedback. If something is not clear, please write an email to us, and we are gonna try to answer to your request as soon as possible. Thank you. Thank you, Giuseppe. And the next question, I don't know if Juan or Alejandro can answer. Which are the agreements for receiving and delivery with logistics operators? Well, I don't have the agreements in hand. We have had a lot of agreements. Among them, we have tried not to stop deliveries. Vendors have had a lot of problems in supplying. The distribution unit at the processes that we have in Insabi, under the responsibility of Mr. Roberto Lin, they have done a great work coordinating vendors and logistics operators that have the obligation of receiving the goods. As such, I cannot answer this, but this is a continuous dialogue to streamline the times. You give us opportunity, as in the page you are writing all questions, we are gonna give punctual and a sharp answer to all your questions through that mean. Then we're gonna make a summary of these questions, and we are gonna publish them. We're gonna post them in the page. Thank you. Next question, I'm gonna ask Giuseppe to answer. Will you be supplying simultaneously the contracts of the first semester along with the second semester contracts, because some previous contracts are not covered yet? This is a very relevant question. Obviously, the supply exercise is a continuous activity, so it is possible to have some stages, simultaneous stages, between the closing of the first semester and the second. So this can happen. We are aware of this situation. It is not that on June 30th we finished the first semester and we start with the second. No, we have some missing contracts, and we are considering this situation for avoiding confusion when guaranteeing the supply. Obviously, UNOPS what is doing is delivering this according planning done by the institutions of the health sectors. We need to respect that program and planning, but if we had the case of a simultaneous supply, we are gonna work in order to eliminate any confusion that can arise from this. Thanks, Giuseppe. Let's go to the next question. I'm gonna ask Alejandro to answer to it. Additionally to the efficacy of the medicines, are you also confirming the safety of them? Can you comment on some actions taken regarding this? On this topic, it is important to remember taking advantage of this platform of today, all the actions that we are doing from Insabi along with the NOMS have the purpose of buying all medicine with the best price and without taking care of quality. We are looking for the best quality of supplies. All this is done to improve and to make these medicines available for people to the further points and to decrease the gap in the access to health that we saw previously. Today we are decreasing this gap with those actions. And regarding the follow-up that we are giving to this, it is a continuous work that COFEPRIS is doing from all hospitals and from the warehouses where these medicines are received. There we start checking the conditions of the medicines, if there is any pallet or boxes that are damaged, if the liquid is damaged, we start vigilance from there, from our side, Insabi and UNOPS. Obviously, COFEPRIS, before a medicine is acquired, is checking that it is complying with all permits and with all the conditions, sanitary conditions to manufacture those medicines. Thank you, Alejandro. And I'm going to give the word to Giuseppe for the next answer. How you are posting the progress of payment of invoices and orders? Okay. I know that, and I am glad that you are interested in this process. One of the measures that we have adopted during the process, and I'm telling this because there were always requests not only coming from vendors interested with contract with us, but also coming from the representation of the chambers of different associations. They were concerned about the payments and delays. So one of the measures to improve transparency and the access to information has been the creation of a portal or a digital platform with payment information. So every vendor with a contract with UNOPS has exclusive access to that digital platform where they can see individually the status of payment of the goods. And this is exclusive because we want to guarantee the integrity and confidentiality of the information of each vendor. Each vendor is getting access to the platform and can check the payment status. Thank you. Thanks, Giuseppe. And let's go to the next question. I'm going to ask Juan Ferrer. With this purchase, the government can say that as from June, they are going to eliminate the lack of supply in the national territory? Well, I have two premises, 2 points that were very well explained by Giuseppe in the presentation. The purchase was divided in this way because in the previous exercise, I mean the last year, UNOPS bought from June 2021 to June 2022. Now we are making a purchase between July to December 2022. This is what we are talking in this fourth informative session. We are trying to explain this to you, and this is related to medicines and medical supplies because UNOPS and these 21 therapeutical groups, I mean, the purchase is for 24 months, and we are completing the year 2022. Insabi made the purchase of 2022 with the number of keys that we had of 1,084. So this means that what UNOPS is doing is complementing the part that was purchased in the last year. So there's no lack of supply. I would like to tell you that all information that we have given here about the keys that have been delivered with the total number of 1,024 keys, UNOPS has complied with the deliveries. We have complied 100%. there is no lack of supply. As Alejandro Calderon said before, we need to recognize that we are not in the 100% in the part of distribution of allocation. And I would like to say that when we had an impasse in the allocation of medicines in the country, immediately the President Andrés Manuel López Obrador instructed us and Sedena, the Navy, and the National Guard to distribute medicines and medical supplies in our country. So we made the deliveries to cover the 32 states in order to eliminate this lack of supply. And we don't have to ignore this. Please don't ignore it, because this coordination serves for making Birmex, that is responsible for this, a strong organism. Look, previously, the federal government was reaching the 32 state warehouses when dispatching medicines. Today, we are reaching the last mile, and we have started working with Birmex, with IMSS, with ISTE, and with the 32 states. This is an intense work that is not done overnight. It is short term, yes, and long term also. But I would like to mention an important point. The collaboration of all workers of the health sector for this to be possible is essential, because we know that all staff in the health sector, that we are looking for reaching all people, that the medicines reach all people. We didn't give up when we saw we had 100% of medicine supply. What we said was that we needed to reach all people with these medicines. It is very complicated, yes, but there were more than 40 years where we were having an incomplete process because we had some barriers for the medicines to reach all people. That's why the President Andrés Manuel López Obrador instructed that we need to reach all people. So we are not satisfied with the acquisition 100%. The logistics operators are being selected by their capacity. We have the support of them that are covering the national territory, but we continue with this support from the armed forces of Mexico, Sedena, Semar, National Guard, and Birmex, to continue with this goal, and we are not going back. We are going to have the medicines, and we are going to reach all the health centers in the country, all the family units of IMSS, all the hospitals of ISTE, all high specialty hospitals of INSAIS, and all the national institutes. And that's why we have called these free drugstores that we are going to set in the third level by instructions of Jorge Alcocer. People going to the national institutes and high specialty hospitals are going to have their medicines. Because the drugstores are going to be next to the hospitals and the institutes. We're going to be reaching people, we're going to be reaching communities closer. Thank you, Juan, for this explanation. And with this question, we are closing this session. We are ending now. We remind you, as Mr. Ferrer said, we are going to be gathering all questions and answers and solving all these doubts in the page of projects that is being published in the screen. We have the address www.proyectosaludmexico.org. I would like to remind you that for purposes of transparency, this session is being recorded in this YouTube channel for future consultations. And with this, we are ending the event. I would like to thank you, Mr. Ferrer, Mr. Calderon. Thanks for your participation. Thank you for being here. To Giuseppe Mancinelli and I, thank you for being with us in this session. And we would like to thank you, the ones that are connected. Very soon we will be having a new informative session. As we have commented, we thank you all for your participation in this event, and please have a good day, a good afternoon, and good night.